Political power is transient. So, as Governor Okowa'S dots the I's and crosses the T's, preparatory to bowing out of office as Governor of Delta State. It is a truism that his wife, Dame Edith Okowa'S, was a pillar of support in helping her husband build a stronger Delta in the views of stakeholders. While she may not have meddled in policy thrust matters, she however contributed to giving the administration a human face as she engaged in humanitarian services such as caring for the poor, etc. In today's episode of Smart Delta, we shall be taking you through a labyrinth of her successes and the impact it had on ordinary Deltans at the bow out of office. My name is Esther Balogun. Please stay with us.
The foundational idea and philosophy behind the O5 initiative was to provide succor to the indigent to enable them to live a productive and fulfilled life without prejudice or recourse to circumstances of birth and/or status. With the launch of the program in 2015 and coordinators in all the 25 local government areas, it soon came to the notice of Her Excellency that there was a plethora of medical issues plaguing Deltans. One such was sickle cell anemia. With the prevalence of sickle cell anemia disease and the quantum of sufferers in Delta State, she knew that something had to be done to reduce its prevalence and bring succor to sufferers. She soon discovered that the ratio of sickle cell clinics to the number of patients across the state was grossly insufficient. Thus, she worked hard and established more specialized centers to ameliorate the pains of sufferers.
Her coming on board was divine and was born out of passion. She decided to single them out so that whenever they fall ill, they can quickly attend to them in any of the hospitals. And the clinics are established inside existing hospitals. She made sure that nurses are trained specifically to take care of those children.
The fuel that drives her passion to bring more meaning to the life of warriors, a pet name she gave sickle cell sufferers, has seen her establish and furnish over 23 sickle cell centers to date. In addition to these, the standard ultra-modern referral center in Asaba, next to the one in Luth, which has helped in reducing mortality in the lives of these warriors while extending these services to citizens of the neighboring states and beyond.
This hospital, every child born here has their genotype determined at birth. That machine was provided by Her Excellency free of charge. We also have facilities for HPLC to determine percentage of sickled red cells in warriors. We have facilities for transcranial Doppler scan. This machine can determine the stroke risk of patients living with sickle cell anemia. So it's something that every warrior has to do yearly. Initially, they had to go to Lagos to access this service, but with the provision of this machine by Her Excellency, people from all around this locale have been coming here to have their transcranial Doppler scan done.
Apart from these centers, seminars and enlightenment campaigns are carried out periodically to teach warriors about proper nutrition and other sundry habits they need to imbibe for self-care to live better and crisis-free lives.
So many of them have testified that before knowing about this clinic and knowing how to care for their children with sickle cell, that they used to have that challenge of recurrent crisis, but that since they started the clinic, that has really been of help to them and the child hardly falls sick.
The awareness is really working since she started it. It has spread. People coming to hear what we teach, how to take care of their children, and most of them, they are having so much hope. We have over 600 clients in this clinic.
Beyond establishing sickle cell clinics, the O5 initiative has been at the forefront of advocacy to curb sickle cell stigmatization. It has taken this awareness campaign to educational institutions.
There was a pilot study conducted and we realized that babies were being born too with sickle cell. So far we have had more than 800 babies screened and about 45 were sickle cell. So you see that once you're able to nip it at the bud, that's, you know what it is, you follow up these children and they do well. So that is the essence of having sensitization, education, and proper healthcare delivery.
Dame Edith Okowa and the O5 initiative have over the past 4 years also initiated fundraising drives for sickle cell warriors, in addition to renewing their yearly premium under the contributory health scheme in the state. Since the contributory health scheme was introduced, more than 3,000 warriors have been registered.
Auntie Lizzie, make we 100,000. Clap for her. Yes, sir. So every elevation that one gets is for the benefit of the downtrodden. God has elevated you, He has elevated myself for the sake of those who need our help.
I spent over ₦1 million assessing help for my warrior. But this scheme has made accessing health care for my son very easy. I'm no more owing anybody. We want to appreciate Her Excellency for this initiative.
Very recently, Dame Edith Okowa flagged off free eye screening for sickle cell survivors. Young and old from across the 25 local government areas of the state benefited from the chargeless program.
Because of the care we give warriors, they live longer than what we used to obtain before. Before they will tell you that a sickler will not live more than 21-20. But that is a lie from the pit of hell. But then there are some complications that could come with their living long. So what we are doing here today is for them to be screened to see if they have blood vessels behind their eyes that the ordinary eyes cannot see, but these machines can pick them. If there are issues, they could be treated so that they don't have issues of bleeding behind their eyes or the retina detaching from their eyes.
We are going to be moving from clinic to clinic. The day that they are going to gather together, we move there, do their eye screening. We have the different screening programs and different research interests that are collating to one single purpose of making them live longer.
Apart from living her dreams of putting smiles on the faces of indigent citizens and helping her husband build a stronger Delta, we soon also discover that she perhaps has a soft spot for persons with medical conditions. This arguably may not be unconnected with the fact that her husband is a medical doctor. Lending fillip to this argument is her partnership with Restore Sight Africa to cater to visually impaired persons.
The programs have actually been very impacting, both in the health sector. I know that is on a daily basis, but I remember when they had to go around the entire state carrying out free eye surgeries where thousands of people were operated and several of them received glasses. I remember the various sickle cell clinics that she has established across the place with a full center in Asaba. And it's cost her a lot of money, but a lot of people have helped, free with donations in many places. She raises money from the private sector to drive her programs. She's impacted on a lot of people. The idea was right from the beginning.
The trajectory of our partnership with Restore Sight Africa was a grassroots free medical outreach program for the visually impaired. When Her Excellency flagged off this particular program in 2018, little did she realize the kind of impact it will have on the people. This was so because thousands were spared the blushes of blindness, as common causes of blindness such as cataracts and pterygium were handled, and in severe cases, surgeries were done to restore the sight of sufferers.
I'm happy because I don't believe I go take this my eyes here again because I haven't get anything, no picking, nothing. Okowa'S wife, God bless her for me. For this eye when he do for me.
We came in contact with Restore Sight Africa, who told us about the statistics of the fact that there were a lot of people that were having eye issues. And even though it was not part of our core mandate in the O5, because for our health we have zeroed in on the sickle cell anemia, we decided to go into the free eye medical outreach, and that took us around the state. In 2021, we still had some assistance, so we had some outstanding funds, and so we decided to go around the state. But at that time, we did it on senatorial district, and in that outreach, we saw over 6,000 persons for that medical outreach. which covered surgeries, free glasses, and eye drops.
That Dame Edith Okowa, through her NGO, the O5 Initiative, brought added value and humanitarian soft underbelly to governance in Delta State as she helped her husband, Senator Dr. Ifeanyi Okowa, to build a stronger Delta is aptly captured in undiluted joys and testimonies of beneficiaries that gave rise to slogans such as, "I was blind, but now I can see."
When I close this right hand, I can see you now. But before I never see anyone. I don't pay anything. Okowa have done something great, very marvelous. I was blind before. I can see.
Going a little further to see how impactful this free grassroots medical outreach was, perhaps we should look at some of the numbers. During the first phase in 2018 alone, over 26,000 patients were seen, with over 2,500 free eye surgeries done. 16,000 reading glasses were given out, and more than 10,000 eye drops were also given out after appropriate eye tests were carried out. In the twilight of 2021, during the second phase of the program, the medical outreach accounted for 497 eye surgeries. A breakdown shows that 279 cataract cases were handled, while 21,805 cases were also dispensed with. Additionally, 3,030 glasses were distributed and 1,998 eye drops were distributed to the patients. In all of these, the joys of beneficiaries knew no bounds.
Okowa'S wife don't open my eyes. I don't see clear. God bless her in Jesus' name.
O5, they don't open my eye. I don't see well. They go bless all the people where they call here. Everybody eye don't open. And the rest people inside go open in Jesus' name.
The successes recorded in the outgone years spurred her to do more. In March 2022, the third phase of the program was launched, and for a more effective approach, the team narrowed down its work scope to smaller chunks as they reached out to 10 federal constituencies. Besides free eye care, there were free blood tests to ensure safety and improve the well-being of beneficiaries. This time around, over 2,088 successful surgeries were done, as 10,199 prescription glasses were given out. Children prescription glasses 886 and 5,132 eye drops were dispensed. Overall, a total of 18,275 patients were seen.
It is almost 90,000 to 120,000 naira to do the surgery of one eye. Definitely plus the two is almost 200 and something or 300,000. They did it free without taking any money. Indeed, O5 is changing life, one person at a time.
Since 2015, the O5 initiative has paid closer attention and catered to inmates in the 5 correctional centers across the state. The O5 has consistently provided annually Medicare and drilled freshwater wells to provide portable drinking water in the correctional centers, as well as provide other essential materials.
Before now, it was more of a burden on us, awaiting drugs from the headquarters in Abuja. But with this as support, even when the drugs are facing a little delay, we have something to fall back on.
Our SLAC provide drugs from time to time to our correctional centers, even providing boreholes, celebrating her birthday in yearly basis, and a center in the clinic that is yet to be commissioned any moment from now that was built by our Excellency. The clinic is something that one can commend.
Mama Delta, as Her Excellency is sometimes referred to, has over the past 8 years taken her birthday celebrations to the prisons to party with the inmates. This, in her view, aids their rehabilitation process and also serves as a reminder that despite their incarceration, they are still viewed as part of society, as they will come out someday.
You have not chosen to travel to abroad, to Port Harcourt, to those places that is happening in the plane. But you choose to come to a place like this, to come and change life, to come and make us smile again. Mama and Celeste, the mother of the state. You can see smile on my face. So every inmate in this facility, they are also smiling today.
O5, changing the world, one person at a time.
It is worthy of mention too that over the past 8 years, she has made it a point of duty to seize the opportunity of international days as declared by the United Nations to do humanitarian works. For instance, World Charity Day, celebrated globally every 5th of September, has seen her impact hundreds of lives with the payment of hospital bills for patients who are unable to pay their medical bills.
Our Excellency Dean Edith Okowa'S asks you people to go home because of World Charity Day. Hallelujah! Our God is so you are free and free indeed.
Jesus, I thank you. Jesus, you do well, I love you. You don't make my life better. I want you to forevermore. Papa.
821,000. Where on earth can I get that kind of amount of money to solve my bills? But God, I thank you for using this mother. She's a mother. God will bless you.
She has also taken time to reach out to ex-lepers at their settlement in Osiomoga, at other settlements such as Eku, Ibrede, Okwa'S, Jedi, Ayakromo, Abogwashi and Utelugu that she couldn't go herself. She delegated her lieutenants to represent her and also shared gifts on her behalf.
For this World Charity Day, Her Excellency, the wife of the Governor of Delta State, Edith Okowa'S, send us, may we can see you now on her behalf. And she brings this little token for now.
Okay. We salute them well. Thank you. This thing when they do say, may God continue to bless her. The husband will go up and up.
Her passion for the plight of the needy continues to grow, as not less than 53 orphanages and 5 adopted families across the state have consistently been fed from the O5 storehouse. World Orphans Day is special for them.
Every year, the governor's wife, they always call us, especially that time of COVID, and so they send people from Asaba, they do something for us for Obiaroko. All orphanage wait there for this Delta State, now come here today, and we are very happy. Our children will smile, and as the children is going to smile, so also God is going to put smile on our face.
Her Excellency's philanthropy is remarkable, as the Yuletide season is not left out in her calendar of charitable deeds. During this season, she sends food items and money to indigent women around the 25 local government areas through her representatives.
Okowa'S, now up, now we go. They give me rice. They give me groundnut oil. They give me tomatoes. Thank you. As you remember, we now so God go remember. Put the hands together for the good guys.
The storehouse of Her Excellency has always been open since the commencement of the O5 kitchen in 2016. It feeds over 50,000 children across the 25 local government areas during Children's Day every May 27. Her Excellency usually used the opportunity to enlighten parents on the importance of giving children godly counseling, as they are the building blocks of society.
O5 Kitchen has been doing a good job by giving us sumptuous meals. We always look forward to it. We actually match for the rice. They are doing a very good job through that.
I feel so happy to be here, meeting other students, which will help to foster unity. I also want to appreciate the O5 Kitchen. They provided food for us and we are well fed.
One area she has bared fangs on is the fight against gender-based violence and sexual and child abuse. She has provided materials and emotional support to female folks, which have attracted recognition from reputable women's bodies such as the International Federation of Women Lawyers, FIDA. She was given an award as Grand Patron by FIDA.
Your Excellency, ma'am, I want to appreciate you because in my house every Saturday, I find myself glued to the television watching what is going on in Delta State, especially in the areas of health. I have watched with keen interest what you have done in communities in and around Delta to support people, to pay for hospital bills, and to carry out surgeries for the indigent women and children and the vulnerable in society. Ma, on behalf of FIDA Nigeria, we want to applaud you and appreciate you for what you are doing, and we say keep up the good work.
Little wonder then that Dame Edith Okowa was inducted into the Orange Brigade and given the title of a squadron leader.
Nice. Thank you very much. Put your hands together.
If it be in marriage, in character.
Another very important aspect of Dame Okowa'S impact on the lives of Deltans is her advocacy for building a healthy family as an integral part of society. This she considers a panacea for a peaceful and prosperous nation. It is celebrated every 15th of May to commemorate the International Day of Family.
Once there's integrity in the family, in the marriage, of course, yes, your children will pick the good attributes and will learn from it, and also make families that will have integrity rooted in them. So it's been a good one.
Just like Dr. Ifeanyi Okowa has maintained a good relationship with the traditional rulers, the First Lady has likewise maintained cordial relationship with the wives of the traditional rulers, making sure that these royal mothers create a peaceful ambience in their respective homes for their families and their indigenous communities.
O5 team, we appreciate you so much for giving us a peaceful environment to operate. Our governor is able to do whatever he's doing because there's peace in Delta State. You have enabled it. God bless you.
Since 2015 till now, everybody we are happy. The way our Excellency, they feed me and they give me gift every time. Everything is short. It's very nice.
A closely related event is Her Excellency's close ties with other women groups, which she invites for prayers for the state and indeed Nigeria in the Government House Chapel. She has tagged this day, 2nd February every year, as Mothers Arise Day. And icing on the cake for Dame Edith Okowa is the Baby of the Year event. The first baby to be delivered in the state on the 1st of January every year is celebrated by her. She seizes the event to also share gifts with mothers and other babies in the hospital.
For these children that are in this world, nothing will go wrong with them. Amen. In the name of Jesus.
Smart Delta.
Wow. It has been an eventful 8 years in office for the Okowa'S as they bow out. Her Excellency's large heart and philanthropy brings to mind what Kathy Carvin, a one-time senior personnel at the United Nations, once said, "Giving is not just about making a donation, it is about making a difference." Her Excellency's pet project, the O5 initiative, has indeed made a difference in the lives of ordinary Deltans as she's changing life one person at a time. My name is Esther Balogun. Thank Thank you for watching today's episode of Smart Delta.
The feedback segment. Question of the day.
This week, we received a question from Joy Mukoro on our Instagram page, and it reads, as the government is winding down, would the hospitals still cater for sickle cell warriors the way Her Excellency took care of them?
Thank you very much, Joy Mukoro, for that beautiful question. The sickle cell clinics were specifically established in all the hospitals. None is outside the hospital. I want to assure you on behalf of Her Excellency, Dame Edith Okowa, there will be a continuity.
I want to urge all Deltans and all Nigerians and persons from across the world to continue to watch Smart Delta. They're doing so well. It's a good means of communication of what we do in Delta State. I'm quite excited that they've been getting the information out there. If you want to know a lot about what is going on in governance and development in Delta State, continue to watch Smart Delta. You will definitely be able to get all the information that you require.
Text your questions to 07013377589 or send us a DM to all our social media platforms.
You better run, come to Delta State. Come and see the good things where Okowa'S they do. You better run, come to Delta State. Come and see the good things where Okowa'S they do. I see your job and work creation in Delta. Make the youth say them higher. Okowa'S. I see good roads everywhere in Delta. Make the people say them cola. Come live in Delta. Say me I say. Come invest in Delta. Come explore the potentials of our state.